This podcast is for informational purposes only and is not intended to replace professional medical advice or be a substitute for therapy. Please contact a mental health professional as needed. If you are needing urgent or emergency health care, contact your mental health provider, call 911, or go to your nearest emergency room. The information presented in this podcast also does not reflect the opinions of those with whom we may be affiliated, both past and present.
Good morning and welcome to another episode of I Wish I Had the Balls, a podcast about codependency, people-pleasing, and overcoming low self-esteem. And I'm here with my co-host, Dr. Laura Ellick.
Good morning. It's so nice to be here again. We're wearing matching T-shirts again. I love it.
Yeah. I actually asked the person who makes the T-shirt, Board Rebel, if they can make this bigger so it's more apparent on camera, and they're working on that.
Oh, I love that. Yeah. Awesome. Shout out.
Shout out to Board Rebel. So this morning, we have the great honor of having Dr. Sydney Merling with us, who is the founder of the Sydney Merling Center. Dr. Merling is a licensed clinical psychologist here in South Florida, whose expertise is OCD, OC spectrum, and anxiety disorders. Dr. Merling grew up in Quebec, Montreal, Canada. Good morning and welcome.
Good morning. Thanks so much for having me. It's an honor to be here.
Thanks for being here. It's a pleasure to have you, and I'm really excited about this. And when this topic came to mind for me, I immediately thought of you. And the topic this morning is the FSU shootings. Yeah, and it's a tough topic, but we need to talk about it. It's not a one-off anymore. This type of thing has been happening. And there's a lot of, and I don't want to overuse or wrongly use the word trauma, but there's a lot going on in the world for young people today.
Sure is.
I mean, when I was born, we were in the middle of Vietnam. Yeah. In fact, the day I was born, Richard Nixon was in Beijing on the wall. I mean, I just had looked that up. But I think what's different today than it was in 1972 is that the exposure, 24-hour news, everybody is filming current events. I mean, when a tragedy happens, get your phone out, start recording, get it online. Maybe then they call 911. Maybe. So my question to you and my concern for young people, and when I say young people, I mean students, young adults, maybe even college students, graduates who are now starting their life in the world, about to start families, is what effect are these events having on them? How, as parents, can we support them? How, as a community, can we support them? And, just how can we be there for them? So, yeah.
Yeah, these are great and important questions. I think, I'll first speak to the impact that this is having. And it really depends on who you're talking about, right? Mm. People vary, and their reactions vary so vastly. And we were just talking prior to recording about how most people are quite resilient. Mm. That's what the studies show. That's what the research shows, that even in the worst cases of combat, let's say, about 12 to 20% of individuals develop clinical PTSD. The numbers are a little bit higher when it comes to sexual traumas or things like that. But when we're talking about a tragic event like this, most people are able to come to terms with it and come out of it okay.
And return to their center.
Right.
So when people say, and we were talking about this pre-show, that people say I was traumatized, or, what's the difference between I feel traumatized and a legitimate trauma? And again, and I say that now, I don't want to take anything away from anybody. Everybody's had their personal experiences. I don't want to.
Everybody has reactions to this, right? It would be weird not to, right. in a case like this. But most people will come out of it, like after a few. It's normal, especially the day of, in the days following these incidents. it's distressing. You know, these things are things that people see on the news, unfortunately, more and more.
Yeah.
But this hit close to home for us. We're in the state of Florida. A lot of people that we know attend FSU.
Yeah.
You know, it's a different situation when it happens in one's backyard. And of course, their sense of feeling threatened is going to go up a little bit because this has actually happened in reality. And so...
But if I could just say one thing that you said that I think is super important is to recognize that people feeling distress is not the same as being traumatized.
Yes.
Right? A lot of people, many people are going to feel distress. That's a normal reaction.
Right.
But, you know, if you look at the statistics that you were saying, the number of people who develop PTSD, that means there is a large percentage of people who do not develop PTSD.
Correct.
And so, you know, the resilience piece, I think, is super important to recognize that there are more people who do well than who don't do well. And that's not to dismiss someone else's trauma, but I think the media has a tendency to blow everything out of proportion.
Absolutely.
Even when talking about who are the school shooters also.
Right.
And what's the profile of a school shooter. And, you know, it's just another way for the media to make everybody scared. That's not the reality.
I love that you bring that up because I was reading articles last night, and without fail, mental illness or mental health is mentioned in every single article mentioning a school shooter. And well, yes, I mean, somebody who is mentally healthy or well likely wouldn't engage in behaviors like this. My fear when these things happen and come about is that there's going to be an automatic link. It's generalized, right? So there's going to be this generalization that mental illness means danger. And that's where I have the statistics on that because I actually looked at it because I'm so curious about this. And I interviewed on my own podcast someone who has schizophrenia. Right.
And he's a normal guy who fears that people think he's going to kill someone all the time. And that's not him. But
people with mental illness or self-harm or even suicide ideology are not necessarily a harm to anybody else. Typically not.
Typically not.
Yeah.
The vast majority of the time.
Yeah.
So that's a misconception.
So I'm going to probably pronounce his name wrong, but Dr. Raji Gurgis, the Associate Professor of Clinical Psychiatry at Columbia University Department of Psychiatry and New York State Psychiatric Institute, that's a mouthful, says that serious mental illness, which means to them psychosis, so you have to also look at the definition, accounts for only 5% of mass shootings. 5%. So, and Dr. Joel Dvoskin, there was an interview with him, he's an expert in forensic psychology, said if you have schizophrenia, the likelihood that you will kill someone is actually 1 in 144,000. So what they actually have found a link with, and this is going to be a little bit controversial, is they have found a link with autism spectrum disorder and school shootings. Not huge numbers, 8% versus the general population of 0.8%, and 21% of mass shooters do have ASD traits. Now, does that mean it's the diagnosis per se? Absolutely not. These are also the people who tend to be disconnected.
Right.
If you don't have connection, if you don't have community, if you read social skills wrong, that's going to put you at risk. So I want to be very careful that it's not a particular diagnosis.
Right, and that makes sense.
There are so many confounding variables here, right, that we can't iron it down to just one thing. And the second any, correlation or link is made, it gets blown up. And I think that people have to be so careful about that. Yeah. You have to be vigilant not to point fingers at anybody and really sort of just take each case as it comes and really look at what the factors are. Yeah,
and I want to say as a cautionary thing to those statistics is that what I'm hearing from that is it's people disconnected from their community. That may be something that's concerning, and that's concerning anyway. people that are alone and they don't have that.
Disconnected, bullied,
ostracized,
kicked out of school,
Yes.
abused at home.
Yes.
Family might have family members who are incarcerated, so there's
Yes.
disconnection there.
Yes.
All of those things are actually related.
Yes.
Any psychopathology, there are, genetic predispositions in many cases, and then there's so many environmental factors that go into creating a perfect storm, and those vary so vastly. Yeah. We have to be so clear about that.
So, Dr. Merling, what can we do as parents, as community? What do we say to our kids, to our young kids, to our 20-year-old kids, to our kids that are just leaving the home and starting a family? How do we reassure them? What do we do?
The first thing that comes to mind is not just something that I've learned in my clinical training, but it was a policy that my mom actually had as I was growing up. And she said, when kids start asking questions is when it's important to start answering them. Mm-hmm. And so what I take from that is that communication and processing and honest, open conversation matters. Mm-hmm. And so I think that in these cases, to process these things and not push them away and to communicate with your children, again, I think everybody processes these things and experiences these things differently. Mm-hmm. Some people might need to do that more internally. Some people might need to talk about it more. Mm-hmm. But as long as people aren't ignoring what they're experiencing or trying to push it away, mm-hmm. I think that that's adaptive in terms of how they'll deal with it moving forward.
As a parent, as a caregiver, is it okay to say to your kids, yeah, I'm scared too. This concerns me too. Let's talk about it.
It's honest.
Yeah.
It's honest. And I don't think there's anything wrong ever with honesty. You're human too. And yeah, I think that in knowing that they're not alone and that this is a normative reaction, I should say, that makes somebody feel safe, in my opinion.
Yeah.
I think also reading the room is super important. So, my kids tend towards the anxious, particularly my daughter. Yeah. And I feel like, I'm preparing them. And she'll just say, don't want to talk about it. Mm-hmm. Like, stop, you're making me anxious. Okay. Yeah. So my job as a parent is really not to communicate this thing to her right now. Right. It's to listen to her say, it's too much for me. Yeah. And she'll come to me when she needs more information.
Yeah.
And you don't want to also create more anxiety, right?
Right.
So you don't want to...
We want to do no harm.
Yeah. Here's the thing. This is sort of in my area of expertise. I'll tell you, avoidance maintains anxiety, right? Avoidance creates or maintains anxiety. Mm-hmm. So you don't want to avoid these things ever. If the worst case scenario is if a parent says, I don't want you going back to school because these things happened and God forbid you should get hurt, that probably wouldn't be the most adaptive thing. Even a lot of kids are hesitant to go back to school. A lot of college students are hesitant to go back to school. You and I have sort of touched on that and discussed that previously. Yeah. And I think that not facing these things and not having the opportunity to learn that you can still live your day-to-day life and the likelihood of these things is lower than one thinks after they occur. Right. Like these tragedies happen and suddenly they become magnified, right? Mm-hmm. And so it's easy to develop the belief system that now schools are dangerous or now the classroom that was once safe is not anymore. And that's not accurate.
But it's magical thinking.
Yeah.
Right?
It's
catastrophizing.
More catastrophizing.
Because we've seen it with like the recent airlines, small planes and helicopters, and every day there's a story. Those stories were always there. Yeah. They're just publicizing them more now, so it makes it look like flying is so much more dangerous.
Yeah. And I was just thinking about flying because I like to fly. I feel very comfortable on a plane, but there are people that get anxious to fly, and it's extremely safe. Do kids go to school now thinking this is going to happen to me? Is this on the top of their mind?
Not everybody, but I'm sure some. I mean, it certainly impacts the presentation of psychopathology. So what I mean by that is that now, OCD symptoms will latch on to what's important to a person. We know that from the research, but also, can be triggered by current events and things that people hear that their OCD latches onto. Right. So suddenly people with harm OCD who had a fear of harming themselves or harming others, the classic examples of that is acting on some unwanted impulse. I've had kiddos who have stated, I'm scared I'm going to, lose control and stab my mom or my dad. And these are the people who are least likely to do these things. They're so fearful of them. And that's the nature of OCD-related obsessions, right? These intrusive thoughts. But now they've latched on to this type of thing. And what if I get a gun and become a school shooter? What if I shoot up a school, and act on this unwanted impulse of doing so? And
this is really interesting because it kind of flips the script because, we sat down talking about looking at it from purely what if I'm the victim of this, but there are kids out there with OCD that will say to themselves, I'm afraid of what if that becomes me?
Yes, that is harm OCD. So their thoughts or ideas latch onto this and become very intrusive and distressing to them.
Yeah.
So that's come up. It's sort of creeped its way into OCD presentations. There was another thought I had about.
I've seen people do rituals and things like if I do my hair the right way or if I walk through this door at school and not this door at school, everything's going to be okay at school today.
Magical thing.
Right? That's the magical thinking where they
I'm
create
guilty of all
that.
Of this, by the way, I have a lot of magical little OCD things that I do. So to your point, though, are school shooter drills feeding this anxiety? Are they more harm than good?
I think... No, I think it's important, somebody with a predisposition for OCD that presents with OCD can latch on to these things, but you can't stop life.
Right.
That's the whole point, right? You can't stop people from living life because they're struggling. That would be avoidant. Right. These things are important. Drills are important. Unfortunately, we live in a world where we need to know how to handle these situations to do our best to ensure the safety of everybody involved. And it's the OCD that has to be dealt with, not the world accommodating people's pathology.
And I guess like what I just said would be tantamount to safety demonstrations on airplanes, stop not doing them because somebody may be afraid to fly, right? That's harm to the greater good.
Else, right, exactly.
Yeah, then something happens. Right. It's a good point. And, it's interesting is that, one of the questions I've been asked in the addiction field and mental health and being an interventionist is, how do, especially families with resources, how do we protect the family's resources from someone that has an addiction or a mental illness or, just will not act responsibly? And I know that there are all kinds of things that you can do. However, in my mind, the investment you should be making is getting that person the help they need.
Yes.
Because when they're truly healthy and sober or stable or whatever it is, that's the greatest guarantee. I guess what you're saying, it's like the best prevention of drowning is teaching your kid to swim.
Mm-hmm. Yeah. I mean, I think it's some wild stat, and I may get this wrong. I'm not sure if this is, but I've heard this statistic of how it takes on average 12 years for somebody with OCD from the time the onset of symptoms to the time that they get appropriate help.
Wow.
Which is wild, right? Because during that time period, the symptoms are becoming more and more entrenched.
Progressively worse.
The more avoidance is taking place.
Right.
And so they're learning that the only reason they're safe for whatever reason is because they're avoiding or ritualizing or whatever it might be. Yeah. Another point I wanted to bring up of how this could potentially impact people is in the case of generalized anxiety. You know how individuals who struggle with, let's say, agoraphobia or panic disorder, right, or these things, they go to a movie theater
right, sure, yeah,
right, and they're looking for escape routes. And I think, I've heard this come up as a concern as well, that you'll have people who become anxious about these things, which is different than being traumatized. Right?
Good point. Yeah.
It's different than being traumatized. And I think, having a reaction or being affected by something is very different than being traumatized by something. Those are two separate things. But that's what I think we're going to see most of. It's not the PTSD, which doesn't impact most people, like we said, but people do become anxious and avoidant. And so I think the big message that I would want to get across is it's important to push oneself through those feelings to reintegrate back into life as soon as they can.
And we can talk about that with traumatic incidents, or we can talk about that really with everyday kind of stuff too. So I remember I had a car accident 2 weeks after I got my license. It wasn't like a horrific accident, but, I was like shaken up. My mom made me get back in the car and drive.
Right. Yes.
And I was so angry, but I know why she did it.
Yeah.
Because otherwise I would have kept avoiding. And then she would have had to drive me everywhere, which I'm sure she didn't want either.
Right.
But I think exposure work and really putting yourself out there, I've talked about in other podcasts that I was raised in a fear-based household. So a lot of what I did was doing the opposite.
Right.
And teaching myself.
Opposite action.
Yes, to just do what I was afraid of. So when I was shy, I forced myself to raise my hand and ask a question in every class in college. And then if I did that, at the end of the week, I could buy myself a reward. So, and these were things I just came up with by myself.
I love that.
But now I see that it's like the golden standard. So, and you even said you're a little nervous about being on here today on a podcast. So you're doing it. You're doing the exposure.
I practice what I preach. So, when Marc asked me to be here, I was like, oof. Do I want to do this? And any inkling of anxiety or fear or stress led me to be like, yes, I have to.
That's great. And that's something I should keep in mind for myself, that I need to run towards the event, the crisis.
That's the name of your podcast.
Yes. Well, look, I'm not here and didn't start this to heal anybody else. I'm here to get help for myself. This is the whole scheme. Yeah. But, the thing that I hear from parents all the time, and I get calls from parents all the time about, all kinds of things. But the number one thing I hear is their anxiety. It's anxiety. That seems to be the number one thing, and it's perpetuated by social media, addiction, screen addiction, gaming, and
I think it's
marijuana for sure.
I think it's most perpetuated, and this is, again, I'm not speaking from any stats. I'm speaking from
experience.
By accommodation.
I agree. Yes.
Family and symptom accommodation.
Yes.
Because loving parents don't know any better.
We rob our children of the journey. I struggle. I say that all the time.
They want their children to feel. What parent wants their child? Most parents want their children to feel comfortable, and at ease, and don't want to watch their children suffer. And so, not many parents will have the instinct to put their kid in the car after the car accident, right? Yeah. It's I want to keep them safe, and as well-meaning and as well-meaning as they are, and as much as it comes from a loving place, it backfires.
We're hardwired to save our children.
Yes.
Yeah, I completely agree with you, and this is a topic that I talk about so much with parents that call me about their kids, and about how, and most of the time, what I'm hearing when I'm on the phone with parents is, you can't say this to them because most will go away and nothing will get done, is that, their recovery plays the biggest role. And I've always said that sometimes the best way to help someone else is to work on yourself. And that is true. And so we put our crap on our kids, and we deprive them of their struggle. So we really are good, and maybe a generational thing, I think, because we're really good at protecting and cuddling them and, oh, baby, sweetie, that's okay. Where I think our parents' generations, we never went to the urgent care. We never get out there, and did a better job of preparing us for the world,
for life.
And that's a parent's job, right? And I'm not saying I do this very well either. I mean, I'm the worst. I'm a bad enabler to I always say that my daughter's closing rate is like 99.9%. So I'm really bad. But our job is to prepare them for the world out there, not to.
How do you feel after the shooting as a parent?
It's interesting. My daughter's graduating college next week.
Right.
She actually is going to go into law enforcement as her.
Congrats, by the way.
Thank you. Yeah, I can't, it goes really fast. So the thing, I worry about her, of course, and I'm that parent where, I always text her at night because she rents a house with some other girls and locally 10 minutes from here. But I text her at night and say, good night, sweetie. And I just want to see that she's like, okay, good night, Daddy. You just want that communication. I mean, if I had my druthers, I'd have her move back into the house. And I'm trying to get her to be 8 years old again or something. But
not adaptive.
No. But part of it's my own fear of mortality. I see her getting older. It must mean I'm getting older.
No.
Yeah.
Never getting older.
I know.
No.
It's the worst. I mean, Laura, your kids are, you have a younger kid. Your daughter's what, 16?
She'll be 16. Yeah. So I have a son who's 22, a son who's 20, and a daughter who's 16. So my hope is that I've taught them skills so that they know what to do in situations. I've done exposure work with my kids a lot. I haven't been perfect. I've enabled a lot because my daughter has a lot of anxiety. So, but it's been, no, we're going to do this and I'm going to walk you through it and we're going to talk about it. And she'll kind of get there. I think, it's interesting. I'm a big believer in getting up and using your resilience and putting yourself back out there. And I know there was a lot of criticism because I think FSU opened after a day or something like that. And people thought that was so disrespectful. I understand why
they did that.
They did it. Yeah. And we can learn from COVID, too. The longer the isolation, the longer we were disconnected, the worse
Which
it
goes
became.
Back to what Dr. Merling is saying is avoidance begets anxiety.
Yes.
Right. And so one of my questions about OCD, I have a couple questions about OCD, because that's like your specialty. Number one, do you see that as certain things happen in our culture, you then have people coming in with more OCD type symptoms related to that? So during COVID, did you have people coming in more who were germ phobics?
COVID was a wild time for OCD specialists.
Yeah.
I joked that it was like busy season for like a few years.
Yeah.
It was. So here's my thought on that. OCD and anxiety, when somebody has like clinical levels or a clinical diagnosis, it is triggered by stressors. Now, that was a major stressor. So that in itself could, lend OCD or lead to OCD erupting, right? For those with contamination fears, I think it was kind of double-edged sword because some of these individuals felt validated and were like, ugh,
see, I've been saying this forever.
like,
Right.
see, guys?
Yeah.
which was not the most adaptive or healthy thing.
Right.
But it was very complex because I remember having a conversation. I was working in a different treatment center at the time, and I had a conversation with a clinical director who said, it's interesting because technically, can we even diagnose this right now if the fear is rational? Right?
Right.
Like there was rational fear. So what did we do with that? How did we tease that apart? It was those who went above and beyond the CDC recommendations, right? Anyways, I digress. But, But all to say, I mean, OCD symptoms latch on to what's important to people. So at that time, that was really at the center of people's attention. And I think it was particularly hard for people with contamination fears.
What I think is really interesting is, given that I have a history of OCD, I felt safer. I felt safer because I was flying and everything during that time.
Yeah.
I would go to JFK.
Because people were taking more precautions.
I would go to JFK Airport and I'm like, they're washing the walls. They probably have never washed the walls. I love this. This is great. So it's, back to my baseline of I think people are gross. But, previously, I mean, listen, we did not learn anything during COVID. Like we used to use tissues to sneeze. We used to now I'm on a plane and someone just lets it fly. And I don't think that's
not good either.
That's not good either.
That's interesting. That's interesting that was the experience. And I'm sure others could relate to that. I think it was probably also really difficult for individuals with health anxiety. That's who it really hit, significantly as well.
Yeah.
Well, I have one other question about OCD. Do you think OCD is culturally determined? In other words, the contamination fears or self-harm or religiosity, are certain symptoms more prevalent in certain cultures than in other cultures?
Interesting question. So OCD doesn't discriminate. And as far as I know, the last time I checked the research on this, no. But what we do know, again, what the research does show is that OCD latches on to what's most important to people, their values, right? It's a threat. It's what threatens, or the OCD will threaten their values, their value system.
So someone who's an atheist, let's say, may not develop any God-centered OCD symptoms. Right. It may come out in germophobia or contamination or something.
They could still develop scrupulosity, which is, religiosity is kind of a subtype of scrupulosity, which is moral OCD. So you don't need to be religious to develop scrupulosity or be affiliated with any particular religion. Scrupulosity is just fear. It could just be fear of being a bad person or doing something wrong.
Which I'm seeing more of, by the way. Yes. I'm not sure why.
Is that what's, and I don't want to get into politics at all, but is that what's going on with some people who are, going through, I know some people that are going through, they're depressed now. They're really hyper focused on the political, and not to say that stuff is not important.
Right.
But they are
really, really impacted by it.
Yeah.
I think there's a lot of, from what's been communicated to me, there's a lot of fear around that, and I think with fear in a situation in which you don't feel you have much control, it can breed a sense of helplessness or hopelessness. And that can lend to feelings of depression.
Yeah.
So, I mean, we live in a complex world these days.
It is. And we get 24-hour news, and it was not like that. And in the past, it took news time to travel. You had to read about it in the newspaper the next. Now it's like the second.
Instantaneous.
And it will get worse. I mean, it's going to get worse, right? Because we're going to be bombarded. We're going to have to learn to just tune out so many stimuli, so many things.
I canceled my cable.
Did you?
I canceled my cable, And I really, it's on the downside. I'm not as brushed up on my current events as I probably should be. But you know, it got too much, and it felt, I'm all about living with uncertainty. That's what I preach every day. And so I really try to
fear faith thing, right? Do I live in fear? Do I live in faith?
Yeah. Mm-hmm. You know, there's somebody recently said to me that I'm Jewish, and from a Jewish perspective,
Mazel tov.
somebody said to me, and I thought there was a lot of truth in it, that it's a lack of faith. Anxiety is nothing but a lack of faith, which I think is, you know, whether you term it faith or the ability to sit with uncertainty and being okay with not knowing and not having answers or not knowing what's going to happen. Life is uncertain. This world is uncertain. And if we're consistently trying to find answers and be certain and know what's going to happen, it's a losing battle. We're trying to control something that just can't be controlled. And that's where I think people fall into.
I call that being surrendered. You know, am I surrendered? And often I'm not. I'm surrendered to the situation, surrendered to the... So I'm just looking at the time. We're kind of out of time, right?
We have a couple minutes.
Okay.
I just want to know from you, obviously the gold standard for OCD is exposure and response prevention, correct?
Yes.
So for people who don't know, can you just tell them a little bit? I mean, the example I use is I'm going to throw you in a room with spiders and close the door.
Oh, well, that would be effective, Laura.
That would be flooding, and no one would ever come see me again.
Yes.
Yeah.
There's not much buy-in for that. So yes, we've been talking a lot about the benefits of jumping right in and facing your fears, and, you know, or not avoiding the things that you're afraid of. And that's essentially what exposure and response prevention is, but we do it in a much more gentle,
systematic way.
Yes, stepwise fashion, as opposed to flooding. And we don't always do it so gently, actually. You know, it's on a case-by-case basis. When I say that, I don't want to scare anybody away, because we really go at people's pace. We meet them where they're at, and we never force people to do anything. We inspire people to make changes and choices that are going to help them grow.
But if you don't push them a little bit,
of course, we encourage.
Then they don't grow.
Yeah, I think people need that extra push, but I think they also need to understand why we're doing this.
You know, why the stretch?
Yeah, and so it involves a lot of psychoeducation around that. But essentially, what ERP is having people in a stepwise fashion face the things that they're afraid of. And through that process, they learn the difference between real and imagined danger. But they also, perhaps the greater lesson there, is that they're learning to tolerate discomfort and uncertainty.
Without running away.
Yes. They're learning to cope without avoiding.
Right.
And to really, without escaping the situation. Because escaping or avoiding, like we said, maintains anxiety, because it lends to the belief that that's the only reason people are safe. Yeah.
So I recently heard, and this is a new topic, but that of a psychiatrist that prescribed Ozempic for somebody with OCD and was seeing good results with it. And then therefore they prescribed Ozempic to somebody with anorexia, because anorexia was a subset of OCD. And interestingly enough, so, you know, I'm in recovery, and people always said to me, there will be drugs one day that will, that will will help cut through addiction. And I never believed it. I said, no way, because where does the disease go? And, kind of that understanding of it. And then I started taking it about 6 months ago. And what I've noticed is a lot of the reoccurring noise in my head about cravings for food, and food's been a big issue in my life, have subsided. I'm not obsessed. Have you had any?
Here are my thoughts.
Go
on
ahead.
that.
Go ahead, please.
On instinct, I want to cringe.
Right.
Because,
right.
I mean, that doesn't sound right to me. Right.
Sure.
I'm not a psychiatrist.
Yeah.
I'm a clinical psychologist. So I can't speak to the mechanisms of medication. And I'm always open to the fact that I could be wrong.
Right.
However, why in the case of, and what we know from the research is that certain medications we know through research are effective for OCD.
Right.
Mostly serotonin selective reuptake inhibitors like Prozac or certain antidepressants. Or clomipramine is FDA approved for OCD. However, I think that the best is the combo of both behavioral therapy and medication for severe,
multi-pronged approach.
Moderate to severe OCD.
Yeah.
Now, I always say, especially with kids, I always say, try behavioral therapy first. Why introduce anything that could potentially have side effects, or, you know, if behavioral treatment alone could be effective.
Right. Sure.
I mean, and then, you know, medication, if needed, is certainly helpful.
Yeah.
But I don't know. I can't answer that because I'd have to go by the research.
I mean, as an eating disorder specialist, I can tell you that it's controversial to use that because for a lot of reasons, right? For binge eating disorder, absolutely. It does decrease that craving and people do lose weight. But what happens when you come off the drug and you haven't learned the skills that you need not to
You know, and this is
binge.
true of everything, I think. You know, when somebody, you know, working in addiction, people want a, you know, one-stop fix. And the truth is what really works is, you know, yes, it's abstinence. Yes, it's meetings, which are community and communication. Physical exercise helps tremendously with brain chemistry. You know, therapy, it's a combination of so many things.
It's doing the work.
It's doing the work.
It's doing the work. And I think so many people want a quick fix, and there's always these trendy, you know, drugs or things that come up that people get excited about. But we can't speak much on anything before there's adequate research to determine that this is in fact effective.
Right.
So I would not at this point recommend that.
Right. And I was just sharing my own experience with having noticed that food noise, that reoccurring upset, because when I'm triggered or when everybody has something they go to when they're
feeling it.
When they're feeling it, when they're feeling, you know, and for me, it's what can I put in my mouth?
Could it be that it has just suppressed your appetite? And so it's not really...
I've heard that it does help with the
brain
thinking.
chemistry.
So in the eating disorder program I work for, a client who I was working with who was using it appropriately. She had the blood sugar issues. The doctor, you know, she was great because she said she didn't even have the thoughts. So is it that it kills the appetite and then you don't have the thoughts, or you don't have the thoughts and then that affects your appetite? I don't know which way it actually works. But listen, it's an appropriate medication for people who are really having that blood sugar stuff.
Of course. That's what it was intended.
For everybody else, it's, you know, talk to your doctor about it, obviously. And if you do have an eating disorder, make sure you're really treating some of the underlying stuff too. Otherwise, it will come back.
But currently, it is not a validated treatment for OCD.
And I know that was, you know, and I didn't mean to put you on the spot with that at all. But it was, it was with a psychiatrist.
It's a great question.
That's a great question.
He was telling us that. And then when I brought it back to my own experience, I said, I could see how that could make sense because of the noise thing. And originally when people were saying that, not when I know we're getting off topic now, but when people were saying that, you know, these GLP-1s were helping with their drinking and their even gambling desires and stuff. I said maybe they're just generally feeling better about themselves and they're not feeling the need to drink or to.
But I've also seen in some people it dulls the sexual appetite. So I don't know about that. Some people aren't going to be too happy about that. But in other people, you know, they feel more sexual because their self-esteem is better. So I think the jury is really out on this. But Dr. Lori Merling, thank you so much for joining us today.
And how can we find you? How can somebody find you if they want your
We're located in Boca, the Sydney Merling Center. We're on North Federal Highway in Yamato.
You have a website?
We do. It's www.sydneymerlingcenter.com.
So great.
Love it. Great. It was
you.
so nice for you to come by today.
Thank
I
you.
really, really appreciate it.
Thank you. This
Don't
has been
forget to check out the very next episode of I Wish I Had the Balls with
Yeah.
Marc Kantor and Dr. Laura Ellick.
Yeah, thank you. Thank you, everybody.
Peace out.
It was a pleasure.
Peace out.